I did my internship, I did that instead of the research project, at Emmanuel Medical Center. It's a little bit of background information on it. Emmanuel Medical Center is located at 117 Kite Road right here in Swainsboro, Georgia. Emmanuel Medical Center has been serving people for more than 50 years, and they're able to treat a variety of issues because they have a very diverse set of departments they can use, especially the outpatient clinics. Get that in just a second. Services they provide, they have imaging radiology, that's your x-rays, MRIs, stuff like that. Intensive care, pharmaceuticals, they have a nursing home that they service directly. Laboratory services, that's where you do blood tests, COVID-19 tests, stuff like that. Wound care, that's they deal directly with like cuts, diabetic foot stuff. If you got the ulcers from that, they'll deal with that stuff. Acute care, that's where they're really focusing on one thing. It's kind of like your intensive care units. And the emergency room, which is where I did my internship this time. And the physician practice, that's your outpatient clinics. They have 8 of those that include a family medicine, individual medicine, and a general and orthopedic surgery clinic. The emergency room, as I said, this is where I spent most of my time with the internship. I followed Dr. Akenya Kumbo, Dr. Lift, Dr. Carrera, and NP there named Miss Melissa Beasley, and the PA there who was Mr. Phil Boatwright. A little bit of information about the emergency room. They have 8 rooms in total and a triage. Each room you have about 1 nurse to 2 rooms, sometimes 3, and then 1 that's going to man the triage. Triage is just where they're seeing what is the problem as you're coming in, so the doctors know what to expect whenever they get to your room. They may find other stuff that's wrong with you later, but that's just a quick overview of what you might have. You have 1 doctor on it, and they'll sometimes have a mid-level there, but it's usually just the doctor that's over the whole ER. What I did, I shadowed the doctors and the mid-level providers there, and I did this for about 5 weeks, about 5.5 weeks, because I was only there for 5 weeks and then on Monday. So I shadowed for 4 hours a day on Mondays and Wednesdays, and that added up to about a total of 48 hours. My goals for this internship, since I had one before, I really wanted to learn more about my chosen profession with this, rather than just seeing if it was the right one for me now. I wanted to learn more about it. I wanted to observe the medical professionals at work, and I wanted to expand upon the knowledge that I gained from last time. Really wanted to get in there and see what I might have missed in my previous internship. Some stuff I saw, pretty interesting stuff. I actually was allowed to assist. I was handing him stuff during doing it, but I assisted him with putting in central venous catheters. What that is, it is a type of, think of it like an IV kind of, except it works for fluids, blood, and medicine, as well as drawing blood out. What they'll do is they'll go in through either your subclavian vein in there, inside jugular vein, or a femoral vein. The reason they do it in different areas is because if someone has thrombocytopenia or coagulopathy, which is just your blood thins and it doesn't want to clot like it should, then they don't need to go through the subclavian because they need to be able to put pressure on it to help stop a bleed if it happens. If they're in the subclavian vein, can't really do that. They can do it much better through the femoral or the jugular vein. Treating some different kind of wounds. I showed one right there. It's that diabetic foot ulcer right there. I also helped them with stitching up a knee wound, really. It was less stitching, more just cleaning out so they could get her to someone that can do it better. They cleaned out the wound with saline, stuffed it full of sterile gauze, and then kind of just taped it up until she could go to like wound care or somewhere like that could actually deal with the problem more effectively. And of course, I had to mention this one because it played a big role in the internship this year, COVID-19. This really affected what I could do with my internship because in the previous year, I went to several areas like the behavioral health, med-surg, ICU, all that. But in order to really kind of prevent any kind of spread between areas of the hospital, they had me stay just in the ER. I had about, I think, 5 patients total while I was there that were positive for COVID-19. They ranged from no symptoms at all to having to be on a ventilator and airlifted somewhere like Augusta because they just didn't have the right equipment there to actually treat them properly. So that was a little bit jarring to see up close what kind of damage that disease can do. Even if it's not always that bad, it can get that bad. So like I said, what was different this time, played a role in it. Every time we went into a room, you had to have on gloves, a mask. If you knew the patient was COVID positive, you had to have the face shield, you had to have a gown on. You had to cover yourself completely to help prevent that spread. You had to wear a special type of mask called an N95 mask. It's much different from these or your regular paper masks. It does a much tighter fit to your mouth, really helps prevent that spread. Like I said, I had to spend more of my time in the ER, but through that I was able to see more stuff like the central venous catheter, the knee wound. I was able to see more diagnosis type things and wound treating stuff than just if I was working in the ICU where I see how the nurses operate and seeing if I might be interested in those areas. Every time you came in, had to have your temperature checked. You are not allowed in if your temperature is above a certain area unless you're actually going to get treated. You're not allowed to be there just for your internship or just to see someone. My opinions on the internship, thought was very helpful. I was able to get more of my shadowing hours in that I'm going to need for when I apply to PA school. I was able to focus in more this time because I had a more clear picture of what I wanted to do, not seeing different options, and allowed me to gain more experience in the medical field and narrow down what aspect of it I want to go to as a PA, like family medicine, orthopedics, whichever one of those I might want to go into. Conclusions. I'd say this internship was pretty successful because it really met all the goals I had for it. Best part to me, networking of it. I met several doctors and PAs. I'm still shadowing a PA that I met there. The staff is very friendly. Doctors and the mid-levels are all willing to help you. They're always willing to answer any questions you might have. And so I would definitely recommend an internship to Emmanuel Medical Center to any East Georgia students who would want to do it. That's just the Emmanuel Medical website where I got all the information from the background information. Thank you.